8:12 right now, and breakfast may not be the same this morning for many families. Egg prices continue to soar, right, due to bird flu.
Yeah, that's right. New York State ordered live poultry markets across the city to shut down for a week after 7 cases were detected in our area. State Health Commissioner Dr. James McDonald is in the studio with us this morning to give us the very latest updates on this outbreak. So thank you so much for being here, Dr. McDonald.
Yeah, good morning. It's great to be with you this morning.
So give us the update then. I mean, the poultry markets were closed for a week. There's no public health risk right now. So where do we stand right now? Are there more cases that you found?
Yeah, so I think this public health intervention was successful. There are no human cases of H5N1 or bird flu in New York State. Those live bird markets are open. They were inspected by Ag and Markets. They've been disinfected and cleaned. And then there's going to be ongoing routine inspections and some, of course, unscheduled inspections as well. And really, one of the things that tell everybody is we're being vigilant about H5N1 in New York. Every state agency works together on this. We're obviously monitoring the threat to the public. Right now, the threat is very, very low.
Yeah, but I think people get concerned. They hear that, right? And then they go to the other thing, which is how it affects their wallet. May not their health, but egg prices certainly going up. And we're seeing in some places they're completely sold out. Places like Trader Joe's saying you can only buy 1 dozen. So how does that kind of affect the produce market?
Yeah, so eggs obviously come from chickens.
Yeah.
And here's the thing. When you see H5N1 in a chicken, there's no treatment for a chicken, and they have to depopulate all the chickens. And right now in the United States, there's no vaccine to prevent H5N1 in chickens. That is something USDA is looking at. Some other countries have moved with that, but there's a lot of moving parts to that.
Yeah.
You just can't introduce a vaccine. It has to be approved by the USDA, and you have to make sure it's not just safe and effective for birds, but it doesn't affect your ability to transmit internationally poultry products, right? Because other countries don't want to see that antigen in their chicken. So this is part of why it's a complicated discussion about a vaccine for birds.
I mean, in the meantime, as we're trying to control what's happening and bring everything back to, I guess, what quote unquote would be normal, I mean, how long could that take before we could ever get to back to normal and normal prices?
Well, it can be as long as it's going to be, because right now, when you think about where is H5N1, it's in the wild bird reservoir.
Okay.
And we don't have a way of stopping H5N1 in wild birds. And since they fly and the migratory patterns come through New York and everywhere else, this is where there's exposure. Right now, though, very few cases of humans, right? We're talking about 68 cases of human beings in the United States.
And how do they get it?
2022. So how people get H5N1, mostly it's been dairy workers. 2/3 of the cases are dairy workers. They got pink eye conjunctivitis because the infected milk splattered in the eye.
Oh my
How
gosh.
other people got it generally were they were depopulating birds. Poultry workers who were dealing with H5N1, they're wearing the personal protective equipment. It's hot, they're sweating, things are falling off, there's breaches. But really, when you think about it, 68 cases in the United States since 2022. We're being vigilant about this in New York State. Comprehensive approach, all the state agencies are involved, so we can manage this and make sure the risk is very low in New York.
Before we move on to other topics here, mutations obviously are something people hear about, and how viruses can jump from one animal to another. So you're talking about how you're monitoring the bird population, but are you looking at other places? Other places in the country had some infected cows and so on and so forth. What does that mean for New York?
Yeah, so really the day we live in now is amazing with science, right?
Yeah.
We have molecular sequencing on every virus that we detect, right? So we talk among all the states. I have Wadsworth, the premier public health laboratory, right here in Albany, and it works great here. But we know when there's mutations occurring, we track them, and then we can assess, is there a risk to humans? Right now, the risk is very low.
Good.
Okay, we want to totally switch gears now and ask you about the cell phone ban. The ban in schools across the state. There's a lot of support among state lawmakers. So can you talk about where we are with that?
Yeah, 19 other states moved in this direction. Canada did too, some other countries. It's a common sense approach, right? And really what it's about is moving kids in the classroom from distraction towards interaction. You know, when you think about academic success, I think we're lying to ourselves when we're multitasking. Are you guys like me? Sometimes you're on your phone during a meeting and you miss what happened, right? Multitasking is really more of a myth. What we're mostly doing is called switch tasking, where you go from one task to the other. Of course, when you're looking at your cell phone, you don't know what the other person said. And if you're in school, you're missing what the teacher's saying. And really, we want the best academic outcomes in New York State. That is very much our future. This is just a very simple, common sense approach. And each school gets to customize their approach. You know, there's $13.5 million in the proposed budget to implement this. Schools get a little bit of money so they can do the strategies they need to make sure that kids can access their parents if they need to, if there's an emergency. but let's not be looking at social media in school.
And that was key. The parents were worried about the fact that they couldn't reach their children. Real quick before we let you go, I want to talk about how you plan to work with RFK Jr., the new Health and Human Services Secretary here. You don't see eye to eye on a lot of issues, including vaccines, fluoride in water, right, which New York does. So how do you see some common ground in working together?
Yeah, so states regulate who gets a vaccine.
Yeah.
Municipalities regulate fluoride in the water. I'm really focused on the mission of the New York State Department of Health. My job is to protect and to promote the health and well-being for all, built on a foundation of health equity. I absolutely understand my assignment. When there comes time for us to align, I look forward to it. When there comes time where I need to call out and protect New Yorkers, I understand my assignment.
Understood. I appreciate the time today. Come on back soon. I know you work at Albany a lot, but I know you're here in New York City a heck of a lot. Dr. McDonald, great to see you, okay?
Thank you. Have a great day.
You too.